Something particularly ugly has happened in Florida over the past year or so. The state has turned itself into the national leader in, and I shit you not about this, denying health insurance to children. We're going to explain how in just a sec. Hello, and welcome to Seeking Rents, the podcast. I'm your host, Jason Garcia. I am the publisher of Seeking Rents. That's a newsletter in Florida about state politics, but with a particular emphasis on the ways that big businesses and other special interests influence public policy in the state. That name, Seeking Rents, comes from a term in economics called rent seeking. And rent seeking is what's happening when someone with lots of wealth and influence, like a big business or a billionaire, uses that wealth and influence to get laws changed in their favor in a way that allows them to capture even more wealth and influence for themselves, usually at the expense of someone else. So, a really ugly story has played out in Florida over the past year or so as the state has become, and this is true, the national leader in denying health insurance to children. This has happened in a couple of different ways. It began when the DeSantis administration launched a particularly brutish purge of state health insurance rolls after protections that had been put in place during the COVID pandemic, after those protections expired. Something like 500,000 kids in Florida lost health insurance through the state's Medicaid program through this, they called it unwinding process, which was in Florida was one of the most aggressive and error-filled unwinding processes in the entire country. But it's still continuing today as the DeSantis administration is kicking kids off of a second healthcare program, too. That program is called Kid Care, and it exists to provide healthcare coverage to children whose families make too much money to qualify for traditional Medicaid, but not nearly enough to afford adequate healthcare coverage on the private market in this uniquely up American system we have that where we trust all our healthcare coverage to a bunch of giant for-profit corporations. But that's still not all. You might remember that a couple of years ago, the state of Florida passed this expansion of its kid care program. This got a lot of attention at the time. It was a bright ray of light in a 2023 legislative session that was otherwise marked by just really ugly culture wars and gross corporate favors. This expansion, which passed with bipartisan support unanimously through the Florida legislature, signed into law by Ron DeSantis, was supposed to extend healthcare coverage to something like 40,000 more kids in Florida. That was almost 2 years ago. It still hasn't been implemented. The DeSantis administration is sitting on this expansion and refusing to implement it. Now, as you might imagine, with anything involving health insurance, a lot of this stuff is wickedly complicated. So I wanted to invite someone onto the show who could help walk us through it all. Joan Alker is a public policy professor at Georgetown University and the executive director of the school's Center for Children and Families. Joan is a national expert on the insurance programs at the heart of this stuff, Medicaid and Kid Care. She's also been a powerful voice and a real champion calling attention to what's been happening here in Florida as so many kids have been losing their health insurance over the last, year or so. She also seems to have a particular knack for getting under the skins of some of the very worst people in Tallahassee. So she's a perfect person to have on this show. Before we get to it, just a reminder to click the like and subscribe buttons. And as you listen to this show, if it spurs any thoughts or any comments, please leave a comment below. Okay, let's get right to the conversation with Joan Alker. Joan Alker, welcome to the show.
Thanks so much for having me.
Yeah. Thank you for doing this. I'm really glad and grateful that you agreed to do this because this strikes me as one of the most important stories in Florida, one of the more sort of inhumane stories in Florida, but not a lot of folks quite understand what's happening because the mechanisms involved are so complex. So I thought maybe you could walk me and listeners and viewers of this stuff through. There's a couple of different fights that all kind of tie together, but maybe the easiest place to start is what these programs we're talking about are, what they do, what the point of them is, and then we'll go from there.
Sounds good. And you're right. This is an incredibly complicated subject. Healthcare's policy is very complex. And then put on top of that, Medicaid and the Children's Health Insurance Program, which in Florida is known as Kids. you've got even more complexity. And I will say that Florida's system of public coverage for children, I believe, is the most complicated in the nation. So
Oh,
you've
great.
got complications upon complications
Right.
here. But basically, Medicaid and the Children's Health Insurance Program, which sits really on the shoulders of Medicaid, work together to cover almost half of the children in the country. And that's true in Florida. So this is a critical piece of the puzzle to ensure that children have access to the healthcare they need to grow and thrive, as well as to protecting families from large medical bills. And, when we're talking about children, and my kids are just out of college now, but when they're little, especially, but even at any time, they're not expensive for a health system to cover, but they absolutely require regular care.
Right.
You're in and out of the doctor's office a lot. They need their checkups, they need their shots, they get flu, they get strep, they need
Right.
antibiotics, they get asthma, they fall on the playground, they need stitches, and then of course we have kids that have more serious conditions. So any gap in coverage for children is really a problem
Right.
in a way that it's not good for anybody, frankly, but it's especially problematic for children since they are regular users of care. And we
Right.
don't want to sit on the sidelines while their health conditions get worse as a
Right.
society. We know that investing in children's health coverage, and Medicaid in particular, has shown many long-term benefits in terms of better economic outcomes for those children when they become adults, less use of public programs, and higher educational achievement and better health. So all of those are good things. So Medicaid covers all children up to about 138% of the poverty line nationwide, and then states can choose on top of that how to structure their CHIP program. And Florida has chosen to have a separate program. States can also just expand Medicaid for children, and then they
Mhm.
only have one program. And that's frankly what, at this point in time, the majority of states do. And that makes it a lot simpler for
Right.
families, a lot less complicated. But Florida has retained a pretty complicated system. And just a historical note, you know, 30 years ago, I guess now, Florida was a nationwide leader on children's health coverage.
What a world.
And yeah, prior to the passage of the Children's Health Insurance Program, which happened in 1997, it was a bipartisan initiative
That's the
by
federal law.
the
Yeah.
federal law, exactly. Senator Kennedy, Democrat from Massachusetts, and Senator Hatch, Republican from Utah. And out of the ashes of the Flynn health reform rose the CHIP program. And there were a few
Mhm.
states that already had that kind of program, Florida being one of them. So Florida really was a model for the nation. So it's sad to see where the state is now, which is unfortunately the state is a leader nationwide in pushing back on ensuring that kids have access to continuous coverage.
Right.
So Florida also is below the national average in terms of their eligibility for Medicaid and CHIP. Taken together, the national average is about 2.5 times the poverty level, but Florida is only at twice the poverty level.
Mhm.
So you have, children whose families are working families, but they don't have access to affordable employer coverage. And that's where CHIP comes in. It's a program obviously designed for children, children's
Right.
health insurance program. It's different from the marketplace coverage, from Obamacare coverage, which really is not designed with children in mind. That's
Right.
designed primarily for adults because of Medicaid and CHIP. So the legislature, I think, recognized this and expanded your kid care program to 3 times the poverty level last year. And
This was a
but
big bipartisan vote, in the middle of like one of the most toxic legislative sessions we'd ever had. This was a huge sort of like moment of positive progress.
that's right. And we've seen this over the years, again, that children's coverage has really been a bipartisan issue in many places. And that's great. But unfortunately, we're seeing slippage there. So yes, the legislature came together. There were a handful of states actually last year that did decide to expand coverage for children. Maine was another one, Arizona was another one. And this is a really technical thing, but due to
Great.
what is a technical, it's just an administrative glitch in the Affordable Care Act that Congress hasn't fixed yet. States, if they want to expand their CHIP programs, They can't just submit a state plan amendment, which is a simple way to do that. They have to come in to the federal government and request what's called a Section 1115 waiver. Now, Section 15 waivers, that applies to the Social Security Act. That's a lot of people think about Section 1115 waivers and they think Medicaid, right?
Hmm.
And Florida has a big Section 15 Medicaid waiver. So a lot of folks in Florida are familiar with that term.
Right.
But it's not just about Medicaid, it's also about CHIP. And so the state had to come in for a Section 1115 waiver, and they didn't know it.
Right.
Now, I'm not going to,
I'm sorry, they didn't know it when they passed the legislation expanding their, I think we call it kid care, but the state level chip, Florida's chip, basically.
that's
Right.
right. It seemed that nobody knew it. We've written about this in various papers, but admittedly, it's an obscure
Right.
technical issue, right? So I don't blame anyone in the legislature for not knowing that. However, the state, by the time they sort of got around to applying and thinking about enacting this, it was pretty late. And also to be fair to the state, the federal government had never written guidance on this. So, but we know that last fall they found out that they had to do this Section 1115 waiver.
Yeah. And I'm sorry, can before you keep moving, just to sort of like consolidate our learnings here to make sure I'm still following. So you've got Medicaid, which is for like the lowest income folks. And if my understanding is kids can get essentially free healthcare insurance under Medicaid if you qualify for Medicaid, and then CHIP or Kid Care in Florida that is for folks that are slightly higher income, so make too much money to qualify for Medicaid, but obviously far within range of poverty level or just barely above, and so it's meant to provide subsidized insurance to kids who don't qualify for Medicaid, but don't whose family parents don't make nearly enough money to afford private insurance. Do I have that right?
That's exactly right.
And
Yes.
so, and going into 2023, Florida was one of the most restrictive states in the country when it came to like eligibility by the number of kids it would provide kid care to, this Florida chip. But they passed legislation in 2023 that would have expanded this program to, I think, did you say up to 300% of poverty
Three,
level? Is that right?
yes. So three times the poverty level. Right
Okay.
now, they're essentially two times the
Yeah.
poverty level.
And also just so I have this right, I think I've read that roughly 120,000 kids qualify under Florida are covered by Florida's current kid care program or Florida CHIP program, and that the expansion would be something like 40,000. Do those numbers sound right to you?
They do, except I have not looked at the enrollment lately. So
Okay.
you should double check that, or we
Yeah.
can double check that for you.
Yeah. I'll post an exact number, the most up-to-date numbers in the show notes. But directionally, I think that's right. And then so they passed this law to expand kid care, which is a great law. Passed the legislature unanimously. Everybody was supportive. Even the big business lobby, who God knows I've got my concerns with, was a big cheerleader of this too. But they didn't realize that they had to go to the federal government and get this sort of complicated waiver in order to implement it. Is that if I
That's right.
okay? So
That,
that's where we're at. Sorry,
yes.
I didn't mean to hijack. I just wanted to make sure I was still following.
Yeah, no, it's so complicated.
Yeah.
And then on a different track in Congress, federally speaking, Congress passed, and I should have double checked this. I think it was the American Rescue Plan Act. It was one of the bills they passed during the
I thought it
pandemic.
was like Consolidated Appropriations Act, but is that also the
Yeah,
American
yeah.
Rescue
No, you're
Plan?
right.
Are they the same thing?
No, it's not the same thing.
Okay.
I think you're right. It was a consolidate. It was the end of the year big budget deal, which is
Is that the same thing? These are the type of probing questions you get here. Okay.
well, no, it's a good question, and
Yeah.
I should have checked that myself. I got to look it up, but I think
Yeah.
you're right. I think it's Consolidated Appropriations Act. So, as you know, during the pandemic, one of the protections that Congress enacted, actually in the Families First Act, when President-elect Trump was in his first term, and he signed this bill, that nobody could lose their Medicaid during the public health
Right.
emergency. And so everybody on Medicaid had a period of continuous coverage. And that was a very important protection.
And
So
just to make, I'm sorry to interrupt, but continuous coverage essentially means once you get in, you can't be kicked out. So if you qualify for insurance, you can't lose it while a period of continuous coverage is in effect. Is that right?
that's right.
Okay.
That's right. You can obviously, if you move out of state, you're no longer eligible.
Mhm.
But correct. So if your income went up a little bit, you're still going to get it for that period of continuous coverage. And what we have found over the years with children is that unfortunately, there's not a ton of income fluctuation for low and moderate wage working families. And because eligibility is higher in general for children with the CHIP program, that a lot of states were interested in 12-month continuous coverage for children in Medicaid and CHIP. And that was what we call a state option prior to the Consolidated Appropriations Act. So states could choose if they wanted to offer this 12-month continuous coverage period in Medicaid or CHIP or both. And about half of states had chosen to do that. Some of them had chosen to do it just in Medicaid. Some of them only have Medicaid for kids, as I said up front. Some of them had chosen to do it in CHIP. Florida actually had chosen to do it for the youngest children in your Medicaid program.
Oh, is that
Um,
right?
yeah, I think it's kids under 5. That's part of one of the Section 15 waivers.
Nobody tell
So,
Ron DeSantis. Nobody tell Ron DeSantis.
yeah, well, right. Very, very true. This has been there for predates Ron
Right.
DeSantis. And so Congress decided to require all states to provide 12 months of continuous coverage to children in Medicaid and CHIP. So
Hmm.
this is a well-established policy. Many states were already doing it, and Congress just decided it shouldn't matter where you live. We want our children to have this 12-month continuous coverage protection so that, once a kid gets on the program in January, whenever it is, they qualify, they're going to get it for 12 months.
Right.
No questions asked, unless they move.
Right.
So that sort of happened, and the implementation date of that law was January 1st, 2024,
Okay.
for that piece of the 12-month continuous coverage. So that was, a whole nother thing that was happening. So meanwhile, Florida discovers in the fall of 2023 that they have to get a Section 1115 waiver. So I'll just say also that Florida and Arizona were in the exact same situation. Okay, because Arizona's legislature had also passed an expansion in their legislative session that spring. Both states found out at the same time that they would have to get a Section 1115 waiver.
Hmm.
And both states, had to negotiate with the Biden administration to do that and also to get public comment, to go through the process associated with a Section 1115 waiver. Now, Arizona moved very quickly through that process, and they're already covering children.
Oh, that's great.
Yeah.
Yeah, there's a
So
but
just,
coming here.
I'm just putting that out there as a
Right.
comparison,
Right.
right? So Florida, however, essentially screwed up the application and
Hmm.
it didn't do a complete application. And so its application was initially rejected by the Biden administration for not being complete. So they had to resubmit, so that ate up more time. Meanwhile, they sued the Biden administration over the 12-month continuous coverage protection, the new protection in federal law for all children Medicaid and CHIP, regardless of where they live.
Right. Right. Let me just jump into sort of seize on that point for a second, so folks understand. So, as you mentioned, the federal government had passed the consolidated whatever law we settled on what it was, but a requirement of continuous coverage for kids that get enrolled in a CHIP program in a state, in Kid Care in Florida,
Yes.
whatever they call it. And as you mentioned at the beginning, like kids need a lot of maintenance of like preventative care and recurring checkups and stuff you want to stay on top of. So like the idea behind continuous coverage here is that it is particularly harmful when kids have gaps in their health insurance, right? That when they suddenly have to stop going to doctors and miss appointments and stuff like that. And so the federal government implemented this requirement of continuous coverage. And the state of Florida sued to try and overturn that because it essentially wanted the ability to disenroll children
Mhm.
from its health insurance program. Is that and just so folks understand, there it's it seems like the continuous coverage probably comes up most commonly in two areas. One, if a family's income changes where their income might rise above the thresholds and
Mhm.
they no longer could get back in. And so yeah, at the end of 12 months, if their income is up, they wouldn't get back in. But also in Florida, and maybe tell me if this is unique in Florida, if other states are this, Florida also charges premiums. So families have to pay relatively modest premiums for the most part, I think, but they have to pay like I think most recently it was 15 or 17 bucks a month for families at the lowest end of the income spectrum that qualify for this. But Florida wanted to be able to continue disqualifying people who missed a pay if your parents missed a payment, they wanted to take insurance away from the kids. And that's why they were suing to overturn this continuous coverage. Am I saying that all right?
Yes, you're
Okay.
saying that exactly correctly. And so the issue related to trip premiums is this. So there are under 15 states that charge premiums and CHIP. So Florida's not the only one, but it's in a minority of states that do charge CHIP premiums, especially at the low income level, right? Because
Right.
as we talked about up front, children between 138% of poverty to 200% of poverty right now have to pay premiums and CHIP. So I think there was a lot of obfuscation going on around here that the fight looked like it was about charging these higher income kids
Right.
200 to 300% the premiums. But no, it's actually right now, today, I do believe in Florida, the Healthy Kids staff said it right in public at the estimating conference meeting. Florida is the only state I know that is violating federal law right now,
Right.
even though they lost the lawsuit with those children, not
Right.
not the Healthy Kids expansion, the existing very
Right.
low income children. And there are very few states that are charging premiums to children with those low incomes. So they're violating the law right now, and they've pretty much admitted that. So
They've
that's,
continued to disenroll kids when their parents
yes, they
miss a
have.
payment. That's right.
They have
Wow.
continued
E-
because I watched this at the estimating conference, and your state's economist, Ms. Baker, I think is her name, she
she's
was
great.
asking them,
Yeah.
yep, she was asking them, well, how come these numbers are the same, that you have the same disenrollment numbers? Because there's this new federal law. And they said, well, but we're suing about that. And she said, but this case was dismissed.
Right. You lost that
And
suit.
and they said, yeah, but we're appealing that, which that's
Right.
what they withdrew Friday, by the way. They
Oh, is that
withdrew
right?
appeal.
Oh,
Yes.
I didn't know that. Oh, okay.
Yes. I'm pretty sure I saw that come through my email like late in the day, Friday or Thursday, that there was a joint agreement between the Justice Department and Florida to pull the appeal.
Oh,
So that's interesting.
we'll
But
come
I
back
think,
to that in just a sec. But
yeah,
just so folks are following. So Florida sued to overturn this continuous coverage requirement for the federal government, lost the suit, and yet continued defying that rule and disenrolling children.
that's exactly
Right.
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 And let me just say this. It's not that Florida can't charge premiums technically. What they can't do, all states are allowed to charge a premium or an enrollment fee. And I'll just note for the record that Texas charges an enrollment fee. They don't charge premiums every month. And Florida could switch their system and just charge an enrollment fee, and they'd be in compliance as
Mhm.
Texas is, but they don't. So they can charge a premium. They can say you have to pay the premium to get enrolled in Healthy Kids in month one. And they can continue to say you should be paying premiums. But what they can't do is if a family misses their payment, let's say in month five, and by the way, the Healthy Kids staff, when they were testifying, said that they see a jump in families losing children losing coverage in the months of June and July, typically because they're buying back to school supplies, or in
Oh,
December because they're buying Christmas presents.
right.
They always see a bump, which was so
Oh,
sad,
yeah, that's
in
heartbreaking.
not being able to pay their premiums.
Right.
So that's when the issue arises, is what happens in that situation is
Right.
that once the 12-month period has been triggered by the initial premium payment, the child is supposed to remain in Healthy Kids for the rest of the year. And that's the provision that Florida is violating. So I think there are two important things here. First of all, Florida was suing to bring down this protection for the entire country.
Right.
Okay, not just children in Florida. And B, it was not about the Healthy Kids expansion, even though that's what they kept saying it was about. It's happening right now in Florida for lower income kids.
Right. And one thing I think that's interesting about the timing of all this too is if I remember, and correct me if I'm wrong, but the when Florida sued to overturn this, this was the fall of 2023, this to overturn the continuous coverage requirement. And that is right when Ron DeSantis is still running for president and looking for ways to pick fights with the Biden administration. Essentially, what it looks to me like is that Ron DeSantis used kids' health insurance. He used that as a tool to try and pick a fight with the Biden administration, and denying kids health insurance in Florida was the cost of doing business in order to get attention for Florida standing up to an overreaching federal government. Is that kind of how is that what we think was behind this? Or I don't want to put you on the spot trying to like read anybody's mind, but
Yeah, I really can't speculate on the
Mhm.
the motive here. You'd have to ask them and others about that. I can only tell you what I see as a national kind of person who's been
Mhm.
looking at these issues across the country is that Florida really stands out because it's the only state in the country that sued to take down this protection for children. There were no other states that joined into the litigation. And that
Wow.
Florida is really in a minority of states that's even doing this in the first place with
Right.
these kids who are relatively low income. So, and as I said, as far as I know, Florida is the only state right now who is brazenly flouting this
Right.
federal law today.
Right. Right. So you get this situation. So to dial us back to where we were going into the fall. So Florida has theoretically expanded its kid care program, as does Arizona. They both got to go get permission from the feds. Arizona goes and gets it immediately, and it's now covering more kids. Florida then muffs up its application, but then launches a lawsuit to try and overturn the continuous coverage program for everything. And so where has that left the expansion of the kid care program in Florida or Florida chip?
Yeah. So they did fix up their application
Hmm.
and eventually got it submitted to the federal government. And the federal government also has to take public comment. That's part of the process. So they did that. And then it moved into, of course, a period of negotiation. And meanwhile, the lawsuit was going on, right? So they were in a very hostile
Right.
posture to each other. But just a few weeks ago, and it was clear because the exact same thing happened in Arizona, right? So we have the Arizona example, and we know what CMS was saying, which is, yeah, of course we're going to give you a waiver to cover more kids. We want you to cover more
Right.
kids. That's not the hard part. The hard part is, are you going to comply with this federal protection of continuous coverage for kids in CHIP and the premium issue? And so Arizona, which also charged premiums, they agreed to comply with the new protections. So they got their waiver right away, but Florida wouldn't, obviously. So they were kind of at a stalemate.
Hmm.
And then just a few weeks ago, the Biden administration, the Centers for Medicare and Medicaid Services, which is the agency that's negotiating these things, they put an offer on the table to Florida, which said, sure, you can do this and you have to comply. It was the exact same offer they gave Arizona. Arizona said yes, and Florida has, I gather, officially said nothing in terms of an official letter, but in the press was out there right away saying, no, we're not taking
Right.
your offer. We're waiting for our new friend in the White House.
Right. Yeah. So that brings us, I think, to current day. So basically, I believe it was in November is when the feds sort of gave us the Arizona offer where you can do your program. You just got to abide by federal law. You can't take health insurance away from kids once you've enrolled them for at least a year, basically. You
Right.
got to do 12 months. And Florida's response, so and this was maddening too, because the business lobby sent around a big statement championing the federal government has approved our waiver, even though the DeSantis administration turned around and said, no, thanks. We're still not going to do it because we still want the right to take health insurance away from kids whose parents miss a payment. And I think what they've done, and again, correct me if I'm wrong, is they've asked for a 30-day extension to get it into the Trump administration to the point where until after the Trump administration has taken over. And what would be, I think I can probably guess here, but what would be the reasoning? Why would the state of Florida want to wait to decide on whether or not to accept this offer And why would it want to wait until the Trump administration takes over?
I presume that
Mhm.
they think the Trump administration is going to let them waive this protection for children.
And if that happens and waive this protection, meaning allow Florida to ignore the continuous coverage requirement and continue disenrolling kids whose parents miss a payment, right? Like we're punishing
That's right.
kids for, and it's not even right to say behavior because there's all sorts of valid reasons. Like you said, you buy Christmas presents or back to school supplies. That's why you might miss your payment when you're someone making this little, when you're a family making this little income. But sorry, I started to rant and I lost my train of thought. But they,
Yeah.
yeah,
They would essentially be seeking to become the only state in the country that had special permission to kick kids off for non-payment of premium.
right. And what would be other than sort of the impacts in Florida if that were to happen? Obviously, there would be some number of kids who would lose health insurance that should be protected otherwise. But is there an expectation that that would lead to a wider effect where other states would seek to defy or look for exemptions from this continuous coverage requirement?
I mean, possibly it may be that we see an attack on this provision by Congress. I don't know. Congress is definitely considering very large Medicaid cuts.
Okay.
We've heard that repeatedly now. So what, how big they're going to go and what specific policies they're going to go after. We don't know that yet. The one thing I did want to mention too, just
Hmm.
to kind of bring into the discussion, just to make it more complicated, is of course, meanwhile, during this period, Florida, like every state, has gone through what's known as the Medicaid unwinding.
Yeah.
They've checked eligibility for everybody on Medicaid, and over 500,000 children, fewer children are enrolled in Medicaid now in Florida. And some of those children, because I personally have heard from a few parents, which doesn't happen that often, but there are some very, very sad stories of
Hmm.
children who are really quite sick, who would be in that group, 200 to 300% of poverty, who right now have to go into self-pay for kid care because you can buy into kid care at full cost.
Hmm.
It's quite expensive.
Right.
And so there really are families, because this protracted struggle just goes on, and now it's delayed again because, they're now going to wait for the Trump administration. These families, they're hurting. They're hurting
Right.
and they're speaking out about it. And so this has gone on for so long now, and it's really very, very troubling when there are these kids who are sick and they need care, and the
Right.
families facing these large medical bills right now.
Yeah. Yeah. And all this ties together. So just to go dig in a little bit more on the unwinding piece too. So you alluded to this off the top when we've been talking about continuous coverage in the context of 12-month continuous coverage period that's been required of CHIP programs. But during the pandemic, if I've got this right, the the Donald Trump signed a law that required continuous coverage. If you were qualified for Medicaid, you could not be removed from Medicaid essentially during the course of the pandemic. Well, so even if if your income rose above the normal limits that would let you get into Medicaid, which again, Medicaid is the most generous program. It's for the folks that are the lowest income in the community, the most vulnerable people in the community. Even if your income rose above the threshold, states could not kick you out of Medicaid while the pandemic was going on. Well, that long sort of like pandemic continuous coverage for Medicaid. And if memory serves, one of the reasons they passed the Kid Care expansion in Florida was going, and maybe you can elaborate on this, but Florida was a particularly brutish state when it came to aggressively removing people from Medicaid when that continuous coverage period ended and trying to and sort of overzealously removing people, taking people out for bureaucratic mistakes, mistakes the state was making. But while that process was going on, part of the logic, I believe, behind the Kid Care expansion, which again, Kid Care, Florida CHIP programs are partially for people who can't qualify for Medicaid to help get them sort of affordable health care. The the thinking there was we will expand this, and so people that are being essentially kicked out of Medicaid now that the pandemic is over, they can qualify for Kid Care. Was that part of the logic behind that expansion?
I can't speak to that
Mhm.
because I wasn't closely tracking what the legislature was saying at the time, but we're talking specifically here about children,
Right.
right? I mean, that's who's eligible for kid care. And yes, children are, particularly in a state like Florida that doesn't have a ton of coverage for adults in your Medicaid program.
Right.
Children are an absolutely critical piece of who was being affected by unwinding.
Right. Right.
So that was, and from a national perspective, we saw a huge amount of state variation in how they handled Medicaid
Right.
unwinding. This is something we were very worried about, and it turns out we were right. There's over 5 million fewer children on Medicaid today than there were prior to unwinding. Now, if all of those 5 million children had great private coverage that's affordable to their families, I'd say great, but
Right.
they don't. And so we don't know exactly how many do and do not, unfortunately, but we do know that most research projections were that the majority of children who would lose Medicaid during this process would remain eligible. And that's because of one of the things we talked about up front, which is that unfortunately, sort of low wage working families do not see, by and large, particularly when you have young children, you
Mhm.
just don't see large fluctuations in income. They're not just zooming up to be very well off. And so this is part of the problem is that when you see large numbers of children, in particular, as opposed to adults who lost their Medicaid during the unwinding, there's a problem. And you can look at states across the country. Some states did an extraordinary job in protecting children during this process. North Carolina, for example, and Kentucky both took an option to just keep their kids on for another 12 months, no questions asked, because they wanted to protect them.
Right.
We had 10 states that are now doing continuous coverage through a waiver for all young children 0 to 6. They get 6 years
Wow.
of continuous coverage. And this is very
Wow.
exciting.
Yeah.
And these
Right.
are states that looked at, wow, this continuous coverage, particularly for young children and babies and toddlers, is really important. So we want to even go further and push the envelope on this, including, I'll say, we've got Ohio, Republican states looking to do 0 to 3.
Right.
Right. So we're seeing a lot of interest in this and really protecting children, yet Florida is unfortunately going in the opposite direction and did terminate, a very large number of children from their Medicaid coverage during the unwinding. And they were
Yeah.
not alone. Texas, absolutely the worst state, well over 1 million fewer children on their Medicaid enrollment today. But Texas, Florida, and Georgia did account for a good chunk of that national decline that we're seeing in child Medicaid enrollment.
Right. So we've got a situation where Florida kicked more kids off of Medicaid health insurance after the pandemic than almost any other state other than Texas.
In the
Um,
top 10, I'd say
yeah,
percentage wise.
percentage wise, yeah. And then it to much fanfare passed a law expanding health insurance for low income kids, and then sat on the law and has not implemented it for now for a year and a half. And at the same time, is now the only state in the country defying a federal law that requires it to provide the few kids that it's still giving health insurance to, that it has to keep giving them for a year once they enroll them. And they're defying that. They're the only state in the country. That's Do I have the sort of the long and short of where we are in Florida?
Yes,
Wow.
unfortunately, this is why I said up top that Florida has really distinguished itself from moving from 25 years ago, a national leader, to at this point, unfortunately, really picking up the rear here in terms
Right.
of how they're treating children, their access to health insurance.
And I don't mean to put you on the spot. So if you don't know the numbers off your head, but how does Florida rank generally in terms of the number of kids without insurance? My understanding is one of the worst in the country, but do you happen to know?
Yes, it is one of the worst in the country, and I have it. Let me look it up right here. We have a state data hub, and we have that, so I can
Oh, that's
look that.
great. I'm glad I put you on the spot.
Yeah, I'll put the link in the chat. Yes, so Florida ranks 47th in the country for your percent of children without health insurance, 7.5%. So that's quite a bit above the national average and ranks 47th.
Right. Wow.
Alabama always done quite a lot better than Florida. Mississippi even does better than Florida.
Wow.
Florida has been a poor performer for quite a long time on
Yeah.
this metric.
7.5%. Dangerous to do math in my head, but I think that's like 1 in 13 kids in Florida does not have health insurance.
Yeah, and I think the other way to think about it is that it's also over time, it's a larger percentage
Right.
because
Explain
kids
that.
cycle in and out.
Yeah.
If you're talking about kids whose family are in low to moderate wage jobs, and Florida, the way the economy is structured in Florida is you've got a lot of sectors like tourism and hospitality and construction and landscaping, right? These are sectors that employers are not commonly providing affordable health coverage, maybe to their employees, maybe not, but certainly not to their dependents,
Right.
right? Like very hard to find an offer of affordable dependent coverage if you're employed part-time or you're in one of these industries that's just not providing it. And that's where Medicaid and Healthy Kids come in, right? To provide an alternative for those kids. But Florida has had a relatively skimpy program in terms of eligibility. Plus, it's complicated. Plus, they're charging these premiums, which, unfortunately can become unaffordable for families. So they've just got a lot of red tape and a lot of barriers for families and it's not a welcoming climate.
Yeah. Do we know anything about like who are the do we know anything about the entities or interest groups pushing on the other side? Like are there I'm thinking of like groups like the Foundation for Government Accountability or something. Do we know of groups that are like pushing the state to fight continuous coverage or that are pushing for particularly like brutish Medicaid unwindings or who is sort of like leaning on them in the other direction that they seem to be
Yeah,
listening
I,
to?
I would say definitely FGA. Yep,
Hmm.
for sure.
Wow, what a
Um,
what a force for good.
Yeah, they are not they don't value working families have health insurance
Right.
and they just they're yeah,
This is
that's
organization, by the way, we've written about them, basically funded by one giant billionaire, right? Like, so, I mean, and it's nothing seems to float its boat more than making sure people don't have health insurance, low income people don't have health insurance. That's wild. I did want to ask you while I have you. So I spent a lot of time reading the lawsuits and stuff and trying to understand the DeSantis administration's perspectives. And it seemed to basically boil down to their fight against this continuous coverage argument was they claimed that this was turning CHIP, Florida Kid Care, into an entitlement program that
Mhm.
basically now because you couldn't disenroll someone within that once they got in for a year and until the year period was up. What's your response to that argument about turning it into an entitlement program when they claim it was never intended to be?
CHIP was intended to provide children health insurance in moderate income, low wage working families, and that's what it should do.
Right,
And the vast majority of the funding is paid for by the federal government, and children are not expensive for Medicaid or CHIP to cover, quite frankly. In any state, but especially in Florida, the majority of your Medicaid funding is going to pay for seniors and people with disabilities who are in long-term care or who are low-income seniors on Medicare. That's where the bulk of Medicaid expenditures go.
mm,
Children are just not expensive. So I think it's very penny wise and pound foolish. This is almost nothing in the as a percent of the state's budget, what they're what the sum is here at question. I think they said it was $12 million
that's
dollars a
right,
year. You do the math, I think it's 0.01% of their budget or some ridiculous, it's like
right,
a back. So to me, it's worth that investment and more to make sure that our children grow up healthy. I mean, children are our most precious resource and
right,
and we need them. We need
right,
them to grow up healthy and thrive. And even the Congressional Budget Office now is doing studies showing what a good investment it is
right,
to spend taxpayer dollars on children's coverage through Medicaid and CHIP because it pays long-term dividends.
right,
And I think this is part of what's so broken about our political system is that, who's thinking about the long term here,
right,
right? And the fact that there's only good things that come from children being able to access the healthcare they need.
right.
And in the immediate term, nobody can afford, unless you're, a billionaire, to cover medical costs on your own. I mean, it's just not feasible.
Right, right.
So, and, think about the cost of prescription drugs, right? Because people
Mhm.
say, oh, well, the kid could go to the emergency room. Well, A, that's not what we want
Right.
for an A. But if you think about a kid who has asthma, right? Asthma is a treatable condition, but you've got to go to the doctor, you've got to get your meds, and those inhalers are expensive. And there's quite a few. I know my daughter had asthma, and she had like 3 different medications she had to take to keep it under control. And if you don't, the kid winds up in the emergency room, which is very expensive. Family winds up with a very large bill that can push them, into serious debt. And the child misses school. And then they fall behind. And things like asthma for elementary school kids are one of the main reasons they miss school. And then they
Right.
fall behind. And that becomes predictive of they're not going to graduate from high school. And all of these problems ensue. So I have very little tolerance for that argument that as a country, we can't afford the minuscule amount that we are paying as compared
Right.
to other things that are spending money and how much money we have sloshing around here,
Right.
best in children's health.
Right. I think the part reading about this that kind of like broke my brain the most was like you said, they essentially, the state of Florida claims that if it were forced to provide continuous coverage under kid care, that it would ultimately cost the state 12, like you said, $12 million, essentially providing coverage to kids who would otherwise disenroll because their parents missed a payment. $12 million, which this is a state that right now has $17 billion in reserves that we're just sitting on, right? Like, this is less than 0.1% of our reserves, to say nothing of the fact it's a state that charges the easiest to avoid corporate income tax in the entire country, that refuses that allows companies to exploit all these broken tax breaks that they're well aware of. They refuse, they have no problems with like Universal Studios pillaging a program to help high crime communities, but they lose their shit if at the idea that a kid might be getting health insurance when their parents missed a month of payment, right? Like, it's a monstrous thing that, pardon my language, frustrates me.
Wow, that's just horrendous hearing
Yeah.
about the reserves. It's not only is it extremely short-sighted in
Mhm.
terms of the kinds of choices society is going to make, it's just cruel.
Right.
Every parent's nightmare is that their kid gets sick and they can't get them what they need.
Right.
And every parent knows that.
Right. Well, and let me try and end this on like a more positive or oriented way. So if you had a magic wand, you were in control. Obviously, it seems like one of the first things we'd want them to do is take take the approval from the federal government, take in kid care like you said you would, and just stop kicking kids off. Just abide by federal law, like literally every other state in the country sounds like it's doing. Beyond that, if you could sort of implement a couple of policies in Florida that that you think would be most impactful, particularly from the lens of making sure kids have health insurance and are healthy and stuff. What are some other ideas that you'd like to see Florida take on if we had some non-monster leaders?
Yeah. I mean, there's a lot of complexity, as I said, to your Medicaid and your CHIP program. They're not run by the same agency. You've got these premiums, which are a barrier. But the other thing that's really sadly unique to Florida is that, and again, the state has said as much, a family cannot, let's say their income does go up a little bit, they
Mhm.
can't move from Medicaid to CHIP without a gap in coverage. Like the
Oh,
system
wow.
is just not capable of handling that.
That's nonsensical.
Yeah, no, it's
Right.
crazy. And this is where, like, talk about efficient government.
Right.
How come you're the only state in the country that can't do that?
Right.
And apparently the state can't. So that's, I think, a big issue that also needs to be addressed. And then I think the next piece of the puzzle is to really take a hard look at the managed care companies who are
Mhm.
providing the care in Florida and most everywhere. That's not unique to Florida. But let's make sure we're getting good value for the dollar here. Medicaid and CHIP have strong benefit packages. Medicaid's a better benefit package for kids. The pediatric benefit is very comprehensive. And we want to make sure that kids are really getting access to the care they need and make sure that those managed care companies, we've got some good oversight going on. So
Right.
that's what I would do. I would try, there's so much the state can do to remove red tape and barriers and smooth out this process for families and make government more efficient. So ensure that children don't have gaps in coverage. And then once they're in coverage, let's make sure that these managed care companies are really getting the care they need, that the kids have access to the specialists they need, the behavioral health specialists, whoever it is, let's do a better job here with oversight of the managed care companies.
That makes sense. Well, thank you for giving us one possible pathway to the future. Here's hoping we have some leaders that will actually take it at some point. Joan Alker, thank you for doing this and walking us through like such incredibly complicated thicket of stuff. This was fascinating.
Well, thank you so much. I really appreciate your taking this deep dive into an issue it's wonky, but it's so critical
Right.
for families. And there are families struggling right now because of this situation, and it's terrible.
Yeah. Well, hopefully this will help give me the courage to start writing about it a bit more too, just learning it. So,
Yeah,
well, thank
yeah.
you again, and I'm sure I'll be bugging you again with more questions at some point.
Sounds great. Well, thanks so much. And you really, I have to say, you have a fantastic command of the issues. So
Oh,
kudos to you.
that's really kind. Thanks very much. See ya.
Okay. Take
Take care.
care. Bye.
Bye. Thank you once again to Joan Alker for joining the show. We went pretty deep there, and I feel like even then, we only began to scratch the surface of this stuff. So we'll make sure to throw a bunch of links into the show notes for anyone who wants to dive even deeper. Before we go, just a quick reminder: please click the like and subscribe button so you never miss an episode of the show. Like I said at the top, if you heard anything in that conversation that's prompted a thought, make sure to leave a comment below too. Until then, we'll talk again soon.